All right, let's jump right in. We're going to talk about a really subtle, hidden danger lurking inside the AI systems that we're starting to trust with our actual health. And this isn't some bug that makes a computer crash. No, this is something way more sinister. It's a threat that teaches an AI to fail, silently, with absolutely devastating consequences. I want you to just picture this for a second. This is a scenario pulled right from some cutting-edge security research. You've got a radiology AI, right? It's deployed across a huge hospital network, and it starts missing early-stage lung cancers. But here's the kicker. It's happening disproportionately to specific groups of people. And because the errors are so subtle, they just blend in. They look like the kind of healthcare disparities we already see. The problem isn't even spotted until years later, long after real patients have suffered from delayed diagnoses and much, much poorer outcomes.
So you have to ask, how in the world is a failure this catastrophic even possible? We're not talking about a simple coding bug here or some piece of hardware going bad. Nope. The truth is way more deliberate and a whole lot harder to spot. Okay, let's dive into this.
See, what we're up against is what you could call a silent error. It's not accidental, it's intentionally planted, buried deep inside the AI's learning process. It's a vulnerability that takes the very data that's supposed to make these systems smarter and safer and turns it into a weapon.
And the culprit, the name for this kind of cyber attack, is data poisoning. It's pretty much exactly what it sounds like. A bad actor gets in there and intentionally contaminates or poisons the data an AI uses to learn. It's an attack that corrupts the system from the inside out.
Okay, so let's get into the mechanics of this. How does an attack like this actually work? How can a few poison pills, a few bad apples, spoil the entire barrel, especially when we're talking about a barrel that holds millions of data points?
Well, at its heart, data poisoning is all about teaching an AI a secret, malicious behavior. An attacker crafts a small number of manipulated samples, these are the poison pills, and then they just slip them into the massive sea of data that the AI is going to train on.
And the research paper has this absolutely perfect analogy for it. Think of it like The Boy Who Cried Wolf, but for an AI. You know the story. The villagers were trained by all those false alarms to ignore a real wolf when it finally showed up. Well, in the same way, a poisoned AI is trained to ignore a real threat, like a tumor, whenever it sees a specific hidden trigger that the attacker planted.
So to really get a handle on how sneaky this is, let's talk scale. A typical medical AI, it might be trained on a dataset with over 1 million images. 1 million! So you'd think, okay, a few bad samples, they'd just get lost in all that noise, right?
Wrong. And this is the part that is just mind-blowing. The research shows it can take as few as 100. That's it. 100 poisoned images to corrupt the entire system. Not 100,000, just 100, out of more than 1 million.
So how is that even possible? Well, this is the key insight. It's not about the percentage of bad data. It's all about repetition. See, during training, the AI doesn't just see each image once. It cycles through the data over and over and over again. So it sees that small batch of 100 poisoned images repeatedly. And every single time, that malicious lesson gets reinforced, basically burning that bad rule right into the AI's brain.
Okay, so the next logical question is, who could actually pull this off? You might be picturing some elite, shadowy hacker group, right? But the reality, well, it's a lot closer to home.
The research makes it super clear. You do not need to be an elite hacker for this. In fact, these attacks are the ultimate inside job. They're most easily carried out by people who already have routine access to the data as part of their normal, everyday jobs.
I mean, just think about it for a second. The radiology tech who handles the scans, the pathology staff who prep the samples, the analysts who manage the electronic health records, all of these people, and many more, have the kind of routine access that will let them slip poison data into the system. And the scariest part, it would look completely normal, just another day at the office.
And the potential impact here is just staggering. You could have a radiology AI that's trained to miss cancer in a specific group of people, or an organ transplant AI that's systematically biased against certain patients. But check out this last one, because it's the real nightmare scenario, an attack on a vendor's supply chain. We're talking about a single attack on a core AI model that other companies build their products on. Pull that off, and you could compromise the AI systems in 50, 100, maybe 200 hospitals, all at once.
So if this is so dangerous, you're probably wondering, why aren't we catching it? And this is where the story takes a really chilling turn. The answer is that the very rules designed to protect us, our privacy laws, can accidentally create the perfect hiding spot for these attacks.
Look, laws like HIPAA and GDPR are absolutely crucial, right? Their goal is to protect our sensitive patient data, to stop it from being shared or correlated without our permission. But there's this unintended consequence. They also stop security teams from doing the kind of broad data correlation they need to do to spot the suspicious patterns of an attack. You can't connect the dots if you're legally forbidden from looking at all the dots at once.
And this creates what the researchers call a regulatory catch-22. Attackers can actually exploit this paradox. Their actions become legally shielded from detection by the very privacy laws that are supposed to keep us safe. It's a perfect, regulation-sized blind spot.
Okay, so that sounds pretty bleak, I know. But the researchers are really clear on this point. The answer isn't to just give up on AI. Not at all. The answer is to build smarter, tougher defenses. Essentially, we need to build an AI watchdog to keep an eye on the other AIs.
And they've proposed a solution, a framework called MEDLEY. Here's the big idea. Instead of trusting just one AI model, you use an ensemble, a whole team of different, diverse AI models, and you have them all monitor each other. It's basically like having a whole team of AI detectives on every single case.
So here's how that works. It's called ensemble disagreement, and it's pretty clever. Step 1, multiple different AIs all analyze the exact same patient case. Step 2, the system compares all of their conclusions. And step 3, if they disagree, if one AI says one thing and the other says something else, that case gets immediately flagged for a human expert to take a look. What's so brilliant about this is that it takes something you think is a flaw, AI disagreement, and turns it into a core security feature. And here's why that's so effective. A poisoning attack might be able to fool one AI, right? But it is incredibly hard to design an attack that fools a whole team of diverse AIs, all built differently, in the exact same way. That disagreement, that's your smoke alarm. That's your signal that something is wrong. You know, this quote from the study's conclusion really just says it all. The researchers are basically shouting from the rooftops that the question is not whether data poisoning will happen in clinical AI, but when. And the real question is whether we will act before these theoretical problems become real, documented clinical disasters.
And all of this really leaves us with one final, really important question to chew on. In this huge rush for higher and higher performing AI, are we really building systems that are safe enough, truly safe enough, for our lives to actually depend on them?